Where you live matters. Your zip code can predict your health more than your genetic code, and we know this through research in public health. So as you live in communities that are segregated and isolated away from more affluent communities, we know that there is less opportunity for health, access to medical care, access to great schools, access to great jobs and great paying jobs. And so if you're not allowed to own your own home in a community and be part of the community, that will contribute to your health. And history matters to health.
Housing and the housing system is not a simple thing to unpack. The history of housing is not a simple thing. And the implications of it become far more reaching when you have all of this system around being able to purchase a home. Coming out of the New Deal, the Franklin D. Roosevelt administration created a lot of different programs and bureaucracies. Two of those were the FHA, Federal Housing Administration, and the HOLC, the Homeowners Loan Corporation. And it was really to help people purchase homes. They were sort of unattainable coming out of the Great Depression. After the war, most people owned cars. Soldiers were coming back, getting married. They didn't want to live in their parents' or grandparents' old houses anymore. Suburbs really sprung up for the first time, especially in post-war Johnson County. There was a large influx of people coming from Kansas City and buying and building homes here. That regionalism is really very tightly ingrained. And so the population starts to go out of that urban core and into this new thing really called a suburb. There's this real consumerism and American dream. This is the chance for a new generation to have opportunity, to have your own backyard, your suburban oasis. People wanted these things, and the HOLC and the FHA provided that. But they were providing it for white families. Very explicitly in their manual, they did not work with African American families to provide mortgage insurance. So this is a system that's put in place by the federal government to benefit white families in suburban neighborhoods. And so in order to codify neighborhoods to know if they were worthy of getting mortgage insurance, essentially, the HOLC went around with appraisers and figured out what that neighborhood looked like, what the ranking was. Green is the best, brand new houses, all white populations, probably with restrictions on it to make sure it stays white. Red would be a neighborhood that smaller houses, in disrepair, definitely minority populations, African Americans, Jewish families. African American families in Kansas City were probably renting in those redlined neighborhoods. They weren't owning their homes. It was difficult to sell. So that wealth wasn't there. That generational building of wealth because of owning property and owning a home wasn't there. Not everyone who was moving to the suburbs was racist and doing it for racial reasons, right? Your average person probably didn't understand the ramifications of the FHA and the HOLC. Certainly there were people who did, and certainly there were people who were moving out of the urban core to avoid neighborhoods that were going to have minority encroachment, right, as they were calling it. And some folks are fleeing that because they know that's happening and they want something in a community where that won't happen. Deed restrictions had been around for a long time, actually. They're used really in the early 20th century on individual properties to make sure that that particular property stayed in white hands. And there was a real fear about this block busting, that a family might sell to an African American family and then the whole rest of the block would go down the drain, right? Was sort of the phrase. A lot of the talk at the time is talking about home values and how if a minority population moves into a neighborhood, the home values will plummet. Well, there's really little evidence of that, and the FHA didn't ever provide any proof that that was actually happening. And in a lot of ways, today we can look back at the economics, and those integrated neighborhoods, actually, the home values stay higher because you have African American families buying houses. So on the surface of it, it looks like Kansas City and Johnson County is very typical and very average and sort of playing along with every other city. But actually, in a lot of ways, Kansas City is leading this suburban trend, right? Because J.C. Nichols is a huge name in the suburbanization, in building large-scale neighborhoods and marketing them to middle-class and upper-class families. He takes this thing that's already in place, the racial covenant, the deed restriction, and he says, for a real estate developer that's developing a large neighborhood, that's not good enough. We need to do it on the neighborhood level. And so he creates neighborhood associations, homes associations, for his neighborhoods that he's developing. And he says, if you buy here, you have to sign on to all these bylaws that his company's created. And one of those is almost always no African American families can own, lease, live, rent this property. And that's why we see a Johnson County that we do today that's still over 80% white. Certainly there's more minority populations moving into Johnson County. There's certainly a larger percentage of African American families. But these decades of restriction and undesirable place to live if you're not white that hangs over Johnson County and leaves a legacy in many different ways. You know, there's a lot of fighting against these policies up until the 1960s, and eventually that translates in 1968 to the Fair Housing Act, the Civil Rights Act. It calls those deed restrictions unconstitutional. There's probably not as much change as people would like to see, even though those deed restrictions are no longer enforced and it's unconstitutional. It takes time for that to change because minority families weren't able for decades to move into those neighborhoods. And just because they legally can now, it doesn't mean that they have the means to do so. It doesn't mean they have the desire to do so either. There's a perception that needs to be changed as well about how accessible those neighborhoods are.
Our mission in public health is to create conditions where everyone can be healthy. So understanding these historical policies is the first step in addressing the disparities that we know exist today. In Johnson County, we know that housing costs have outpaced wage growth. And this creates an environment where people really cannot afford to live in Johnson County. When people have high housing costs, then they have to stop and think, well, you know, I don't want to get evicted, so I have to pay that, but I may not be able to get groceries this week, or I may not be able to pay my prescription costs and take that medication that's important to my health. So we want to ensure that our policies are inclusive, that we bring people together in the community, we convene groups to discuss the disparities, and we get some work around what the community needs. We listen to the community, and when we can do that, we can create a safer, healthier, more vibrant community with a high quality of life where everyone can thrive.